An asthma attack may strike at any moment, from breathing in cold air and certain cleaning products to exercise and even traffic jams. Identifying and reducing exposure to the specific factors that affect you can help prevent a potential crisis. People with asthma are generally very sensitive to their environment. Some may notice their symptoms heighten during the winter, and that breathing feels like more of a chore when they go outside. And so a dip in temperature can certainly add to your asthma woes. Pediatrician Rupa Thakur said, "Cold air irritates the airways." WebMD explained that inhaling icy winter air can cause the airways to swell and become narrower, and the muscles around them to spasm. Cold air can also cause the airways to become lined with thick, sticky mucus, making it harder for oxygen to pass through. In winter, the air holds less moisture than warm air, which can spark a number of respiratory problems including asthma, sinusitis, and bronchitis, notes the Cleveland Clinic. People also tend to spend more time indoors during the winter where the air is drier, and they're exposed to various other asthma triggers like mold, dust mites, and pet dander. Dr. Thakur added, "The winter season also brings more exposure to cold and flu viruses. A lot of kids have viral-induced asthma, which means they can experience an asthma attack as a result of a respiratory infection." It may not be as well known as other triggers, but emotions can induce asthma in some people. There's evidence of a link between emotional states like anxiety and depression and poor asthma control, according to the Asthma and Allergy Foundation of America. A theory behind this is that our emotions affect the way we breathe, in turn setting off asthma symptoms. The American College of Allergy, Asthma, and Immunology also cites physical displays of strong emotion like shouting, crying, or laughing as potential triggers as a result of changing breathing patterns. For example, scientists have found that strong emotions can cause our breathing rate to speed up and bronchial tubes to tighten, potentially eliciting asthma symptoms or precipitating an asthma attack. Stress is notorious for underlying a wide array of physical and mental health problems, so it's not surprising that it can also worsen your asthma. Research published by Brain, Behavior, and Immunity has shown that the body reacts to stress by triggering the immune system and releasing certain hormones, which can alter the airway inflammatory response to irritants, allergens, and infections in people with asthma.
We'll slow this down together. Feel my chest. Feel it moving in and out. Breathe like me.
Exercise is one of those asthma triggers that can throw you off course. Research published in Scientific Reports continues to show that regular and moderate exercise is beneficial for asthmatics and helps improve asthma control. But for some people, hitting the gym and working out can spark a number of asthmatic symptoms like wheezing, coughing, and shortness of breath, according to the Asthma and Allergy Foundation of America. As many as 90% of individuals struggling with asthma will experience exercise-induced asthma during or after strenuous exercise. This occurs when you breathe more rapidly and deeply due to your body needing more oxygen. When you breathe through your mouth, the air you inhale tends to be drier and colder than the air that comes in through your nose, which brings about a narrowing of the airways. Exercising outdoors during winter is particularly triggering for people with asthma, whose airways are generally sensitive to chilly temperatures, notes Asthma UK. Emma Rubach, head of health advice at Asthma UK, explained it this way. Cold air is a trigger for more than 3 million people with asthma, putting them at risk of a potentially life-threatening asthma attack. If you notice that exercise often leads to asthma flare-ups, your doctor may prescribe a pre-exercise medication to open your airways, such as an inhaler that releases a short-acting beta agonist, the Mayo Clinic notes. Spring can be an especially hard time for people who are allergic to wind-borne pollen from trees, grasses, and weeds, according to the National Asthma Council Australia. And it's very common for those struggling with allergies like hay fever to also have asthma. Pollen triggers an allergic reaction when your immune system produces antibodies upon identifying a harmless environmental irritant, like tree pollen, as an invader. The antibodies bind to the allergen as a way to protect your body from this substance, while the chemicals that are released during this process, like histamine, induce an uptick in allergy symptoms, an itchy, runny, or congested nose, itchy eyes, and skin reactions. For some, pollen can also elicit the onset of an asthma attack by causing inflamed airways to produce more mucus than usual, reports Healthline. Around 60 to 90% of people with asthma struggle with allergic asthma, according to Medical News Today. This is when asthma symptoms and episodes are specifically caused by an allergen, such as pollen.
You ever see pollination up close?
No, sir.
I pick up some pollen over here, sprinkle it over here. Maybe a dash over there, pinch on that one.
Antihistamines can help ward off symptoms, but it's important to note that some corticosteroid nasal sprays, like fluticasone, which are used to treat hay fever or allergic rhinitis, can sometimes worsen asthma symptoms like wheezing or shortness of breath, added Healthline. Ask your doctor about other medications you might be able to take instead to avoid a potentially dangerous asthma attack. Being stuck in a traffic jam might be a lesser-known trigger for your asthma attack, according to Asthma UK. It's not so much the traffic jam itself that's setting off your asthma symptoms, but rather the pollution and fumes released into the atmosphere, which can get into your lungs and irritate your airways. Research evidence in the International Journal of Health Geographics highlights the link between air pollution from road traffic and asthma, explaining that pollutant exposure may increase the permeability of the airways to other allergens to which asthmatics are susceptible. What's more, driving with the windows down might feel amazing, but it will let in all of the toxic emissions spewing out of the surrounding cars. Ryan Thomas, a pulmonologist and director of the Michigan State University Pediatric Pulmonary CMDS Clinic, said, "People who regularly drive with the windows down may find their asthma is harder to control at different times of year." A good old spring clean can do wonders to help clear up your asthma. In fact, the American Academy of Allergy, Asthma, and Immunology, or AAAAI, recommends cleaning your home at least once a week to reduce the amount of allergens in the atmosphere. But it may surprise you to discover that your cleaning products might also be at the root of your asthma attacks. Some household cleaners contain harsh chemicals like bleach and ammonia that are likely to aggravate your airways and make your asthma worse, the AAAAI also reported, which is why it's important for people with asthma to be mindful of the types of products that they use to avoid creating a toxic and triggering environment in their house. If you're opting for commercialized cleaning products, the AAAAI recommends keeping an eye out for those that have been given a green seal of approval. They tend to be gentler on the environment and your respiratory system, as many of them come from natural or plant sources. You can also concoct a non-toxic cleaning solution of your own if you're feeling nifty, using vinegar, lemon, and baking soda in a spray bottle. Mold is one of the many potential allergens that can accumulate in your home. This microscopic organism is a common type of fungus that thrives in environments with lots of moisture, notes the American Lung Association. It reproduces by means of tiny spores that float through the atmosphere and settle on surfaces like the ceiling, walls, and your belongings, causing respiratory problems when inhaled by people with asthma or mold allergies, warns the United States Environmental Protection Agency. Mold spores can irritate your nasal passageways and cause allergies. They can also creep into your lungs and lead to asthma flare-ups, according to the Asthma and Allergy Foundation of America. Some individuals might have trouble catching their breath in moldy environments due to reduced lung function, per the American Lung Association. Mold can cause the airways to constrict and produce more mucus, becoming swollen and inflamed. Some people with asthma have even been known to die due to a mold-induced allergic reaction, so it's important that you limit your exposure to mold. Research indicates that the prevalence of asthma is around 9.7% in women and 5.5% in men. If, like some women, you've noticed that your asthma tends to get worse around menstruation, you're probably not imagining things. Many women have a tougher time breathing during their premenstrual period.
Oh, I understand what's going on. You're all on the same cycle. This is very exciting. Your uterine walls will be shedding for the next 3 to 5 days.
This commonly occurring phenomenon is referred to as premenstrual asthma, or PMA, a condition in which asthma symptoms and lung function start to deteriorate a few days before menstruation begins, according to Everyday Health. William E. Berger, a clinical professor of allergy and immunology at the University of California, told the publication about half of women with asthma report a worsening of asthma symptoms right before or during their period. Premenstrual asthma is attributed to fluctuating hormones. Just before and during your period, your body's progesterone and estrogen levels drop, which can cause the airways to constrict and the cells of the immune system to weaken. It's one of those inconvenient triggers that not everyone wants to concede to, but alcohol might be one of the unexpected things exacerbating your asthma. This has been corroborated by a research study published in the Journal of Allergy and Clinical Immunology. which showed that 33% of study participants identified a link between alcohol and an asthmatic event on 2 separate occasions, with wine being pinpointed as the main inducer. A specific offender is said to be those sulfites, which are commonly added to wine and beer as preservatives, and sometimes appear to have a negative effect on people struggling with moderate to severe symptoms, notes the American College of Allergy, Asthma, and Immunology. Somewhere between 1% and 2.5% of people with asthma also have a sulfite sensitivity, according to the Cleveland Clinic. Another sneaky ingredient that can be found in your favorite alcoholic beverage is histamine, a natural food and drink chemical and a substance that your body releases when you have an allergic reaction, according to Asthma UK. Histamine is developed from bacteria and yeast when alcohol, particularly red wine, ferments. It can cause a host of problems for those who suffer from asthma or allergies. It's recommended that people with inflammation-related chronic conditions like asthma and related breathing problems limit their intake or simply avoid alcohol altogether. While indoor candles and air fresheners may perk up the smell of your home or personal space, they can also cause a host of respiratory problems like asthma, reports the American College of Allergy, Asthma, and Immunology. You might have noticed your symptoms worsening around these airborne irritants. These perfumed products and odorants emit chemicals, smoke, or fragrances that may aggravate existing allergies and provoke the sensitive airways of people with asthma to contract, noted a 2016 study published in the International Journal of Environmental Health Research. Pulmonologist Katina Nikolakakis told the Cleveland Clinic that the problem is that these candles don't produce enough heat to destroy the harmful molecules that they release, and are often burnt in unventilated spaces, which elevates the risk of an asthma attack. Nikolakakis said, "There are many patients for whom anything scented, candles, pine cones, right down to their live Christmas tree, will spark an asthma attack. These are people who just can't have scented things in their homes." While popping an aspirin might help relieve a throbbing headache, it can also give rise to an array of asthma symptoms, according to WebMD. The role of aspirin in asthma onset is rarely discussed. Unlike a lot of other contributing factors, this trigger remains fairly under the radar. Asthmatics tend to be sensitive to certain drugs, with approximately 10% to 20% exhibiting a particular intolerance towards aspirin. Aspirin-induced asthma is a potentially life-threatening response to painkillers that can lead to typical asthma symptoms like breath difficulties, coughing, congestion, and wheezing. These symptoms tend to emerge within 30 minutes to 2 hours of taking a painkiller like aspirin or non-steroidal anti-inflammatory drugs, aka NSAIDs, but can last for hours, notes Verywell Health. Check out one of our newest videos right here, plus even more Health Digest videos about the latest health and wellness news. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.